Mr. Zainal Sapari.
Mr. Speaker, first and foremost, I would like to thank the committee and the Secretariat for this very important piece of work that they are doing. An American politician said, without health insurance, getting sick or injured could mean going bankrupt, going without needed care, or even dying needlessly. And I think we can understand the context why the American politician said this. In America, they have yet to be able to strike a good balance in ensuring the health of the population are taken care of. I welcome the CareShield Life initiative as a step in the direction to provide Singaporeans with an accessible, affordable means to plan for their long-term healthcare needs. This would benefit not just the aged in our population, but also the younger demographics who are increasingly aware of the importance of healthcare security for their future. I am also heartened by the efforts taken to ensure the scheme is inclusive by providing additional support to ensure affordability. But unfortunately, my wife thinks it is selective inclusivity. That said, based on feedback and queries from my engagement with unionists and grassroots leaders, there are some clarifications that I would like to seek from the Minister with regards to the CareShield Life. In terms of policy administration, I would like to ask the Minister the rationale of having the Ministry of Health to administer the CareShield Life scheme. I understand from the white paper that it simplifies administration and will be carried out on a non-for-profit basis. Without a doubt, by having the government administer the policy, it would be easier to adjust the scheme as necessary. However, this then begs the question, why wasn't the same consideration given when ElderShield was first introduced? The decision to have MOH administer CareShield Life implies that there are inherent drawbacks or disadvantages if the scheme is to be administered by private insurance company. What are some of the key lessons that we learned from ElderShield that led to the decision for the new CareShield Life to be managed by MOH? There's also this thinking that the private sector can be more efficient than the public sector in providing services or public goods. With MOH managing CareShield Life, would there be equal efficiency in handling of insurance for Singaporeans? The report also shared that MOH will monitor the scheme closely and make the necessary adjustment to the scheme. Would the policy holders be consulted before such changes, and is there the possibility of a lower payout being rendered in the future? Would the government also consider increasing the percentage of premium subsidy provided, currently estimated at about 20 to 30%, to ensure affordability? I believe that the CareShield Life can provide a great opportunity to incentivize Singaporeans to lead healthy and active lifestyle. Given the worrying statistic on issues like diabetes and our efforts to promote healthy aging, we should leverage on the CareShield scheme premium subsidy to promote Singaporeans to lead an active lifestyle. It is certainly better for a Singaporean not having to make a claim on insurance, and that starts with prevention by choosing a healthy lifestyle. Under the proposed CareShield Life, claims are allowed once the insured are unable to perform 3 out of 6 essential activities for daily living. I do appreciate that setting a lower benchmark would mean higher premiums. However, can MOH consider a lower payout for Singaporeans affected with 1 or 2 disabilities? Given our aging population, long-term care will continue to be a pressing concern for Singaporeans moving forward. It is our duty as a government to not only ensure that we can provide the best level of health care to our citizens, but also to make sure that their financial situation would not take a drastic turn due to expensive healthcare. While there are options to allow for existing eldership policy holders to convert to CareShield, could the government consider converting all eldershield policy holders and absorbing the additional premiums to do so? I know this will incur a huge government expenditure, but it can also give Singaporeans a peace of mind for the added healthcare insurance. Mr. Speaker, in Malay, saya memberi sokongan penuh kepada skim insurans jagaan jangka panjang nasional CareShield Hayat yang dapat menawarkan bantuan keuangan kepada mereka yang mengalami kehilangan upaya yang teruk. Skim ini adalah lebih baik bila dibandingkan dengan eldershield yang ditadbirkan oleh pihak swasta. Saya ingin bertanya, mengapa pemerintah mengambil keputusan untuk mentadbir CareShield Hayat manakala keputusan serupa tidak diberi kepada eldershield semasa ianya dilancarkan pada masa dahulu? Bolehkah pemerintah menanggung kos untuk menukarkan semua anggota eldershield kepada skim CareShield Hayat yang baru ini? Ramai dari mereka yang menyertai skim eldershield akan rasa terkilan dengan manfaat yang diberi oleh CareShield Hayat dan mungkin tidak mampu menukar pada kadar premium baru yang tinggi. Saya juga ingin mencadangkan kadar premium yang dibayar harus bergantung kepada kesihatan para pemohon. Ini adalah untuk menggalakkan seseorang itu mengambil langkah yang lebih proaktif untuk menjaga kesihatan jasmani mereka. Mr. Speaker, in conclusion, given our aging population, long-term care will continue to be a pressing concern for Singaporeans moving ahead. It is our duty as the government to not only ensure that we can provide the best level of healthcare to our citizens, but also to make sure that their financial situation will not take a drastic turn due to expensive healthcare. Few years ago, the government announced Medishield Life, which managed to give much assurance to many of us who are concerned with our ability to shoulder unexpected high hospitalization costs. CareShield Life is another step in the right direction that will provide an added peace of mind for many of us. I support the motion.